Okay, so we're going to start off with the general anatomy of the nervous system. And again, I'm going to go over the topics that we discussed and then talk about some of the important things to take away for the exam. So for the general anatomy of the nervous system, here you want to think about the structures, so the brain and spinal cord. And then you also want to think about the organization of the central nervous system. Versus the peripheral nervous system, and sort of differentiate those different areas. And then we talked about the different types of neurons and then the different types of glial cells. So definitely go over the types of neurons here. So this classification, sensory versus motor versus interneurons. And know basically how they differ, right? One is carrying fibers afferent to the CNS, one is somatic or autonomic going out to the PNS, and so be able to differentiate those. Also know the different types of glial cells. So here they are listed, the 5 types of glial cells: astrocytes, ependymal cells, these are important for lining the ventricles and making CSF. Microglia cells are essentially your immune cells. These are the ones that are going to phagocytose, inappropriate substances or pathogens in the nervous system. Oligodendrocytes are myelinating the central nervous system, and then Schwann cells myelinate in the PNS. So definitely know how to identify your glial cells, right? So the astrocytes are star-shaped. Astrocytes are also important for the blood-brain barrier. And be able to ascribe their function as well. Okay, then we want to think about the structures of the nervous system. Here, the meninges is important. So the structures that help to protect the nervous system will be not only the skull, vertebral column, but the meningeal layers, so dura mater, arachnoid mater, pia mater. Know the order of these structures. Know the location of CSF. So CSF is in between pia mater and arachnoid mater. So in between these two layers is where we have that subarachnoid space, and we have the circulation of cerebrospinal fluid. Okay. Also know your ventricles. So the ventricles we pointed out, right? So the ventricular system is where CSF circulates, and then it escapes and surrounds the brain and spinal cord inside that subarachnoid space, right? Which is in between those meningeal layers. Okay. Thirdly was the blood-brain barrier. So definitely know what forms the blood-brain barrier. It's a combination of the tight junctions of the endothelial cells of the brain, as well as the foot processes of the astrocytes. So definitely know the structures that form the blood-brain barrier and how that protects the central nervous tissue. And then lastly is the formation of myelin. So basically know the myelin cells, oligodendrocytes in the CNS, and like I said, Schwann cells in the PNS. Okay, so those are some of the areas to focus on as far as chapter 9. And if you have questions, I'm going to keep going, but feel free to drop those in the chat in the meantime. If there's anything you want me to circle back to, I'll do that at the very end. Let's move on to the autonomic nervous system. So this is where we started chapter 11. And I'm going to start with this somewhat confusing slide here, but this is really an overview of all divisions of the peripheral nervous system. So the central nervous system is kind of what we just described, brain and spinal cord. The peripheral nervous system is going to include the autonomic nervous system and then the somatic nervous system. So let's review the details of that here. So we can think about the autonomic nervous system as being involuntary, right? It's got 2 major divisions, the parasympathetic nervous system, which is represented down here, and then the sympathetic nervous system, which is represented up here. And I'm going to share these drawings, so look out for those afterward. So here's a cross-section of the spinal cord, and this is showing the levels of the spinal cord where sympathetic fibers arise. So T1 to L2, or the thoracolumbar segments of the spinal cord. The sympathetic nervous system is going to be responsible for fight or freeze or flight or fawn, the fawn effect as well. And it's going to be basically having a shorter preganglionic neuron connecting with a longer postganglionic neuron, and then that is going to synapse onto the effector tissue. And effector tissues in the autonomic nervous system can be skeletal muscle, not skeletal muscle, excuse me, smooth muscle, cardiac muscle, glands, and adipose. So those are the types of effector tissues we're looking at out here. The preganglionic neuron is going to be white ramus myelinated fibers. Remember, we talked about how this emerges from the lateral horn of the spinal cord. So notice where it's arising from. It's escaping through the ventral root, right? Lateral horn, leaving the spinal cord through the ventral root, and then joining that spinal nerve as a white ramus myelinated fiber to form the preganglionic neuron. And then it's going to synapse, and then it's going to become a gray ramus, non-myelinated fiber as it reemerges at the ganglia and then becomes the postganglionic neuron. Now, as far as the options for this synapse, remember the synapse in the sympathetic nervous system had 3 options for communication. One is that it could synapse onto a ganglia in the sympathetic chain, which is right parallel to the vertebral column, or it could synapse onto the adrenal medulla chromaffin cells, and that would result in the chromaffin cells behaving like a postganglionic neuron and releasing hormones instead of neurotransmitters, right? 80% epinephrine and about 20% norepinephrine, and very, very minimal dopamine. And then the third option for communication was synapsing onto a ganglia that was not a part of the sympathetic chain, a so-called collateral ganglia, okay? So these are the 3 options as far as where a preganglionic neuron can synapse at a ganglia and become a postganglionic neuron. The other piece to recognize here is the receptors. So the receptors are the preganglionic neurons. Remember, we said this was a rule across the nervous system, specifically the autonomic nervous system. Okay, it's showing that my connection is a little unstable. Can everyone still hear me? Looks like I'm back. Okay, perfect. Yes, thank you. All right, looks like we're back on. Okay. Just give me a, well, you can't ping me if I lose connection, but let me know if you can't hear me for any reason. Okay, so going back to the receptors here. So all preganglionic neurons release acetylcholine. And so that acetylcholine is going to bind to nicotinic cholinergic receptors at the ganglia. So that is true for the sympathetic system as well as the parasympathetic, which we'll get to in a minute. But acetylcholine crosses the synaptic junction, and then it is going to bind to a fast receptor. Remember, nicotinic is an ionotropic receptor. The receptor is also a channel. So as soon as it binds, channel opens up, ions begin to move, sodium moves in more than potassium is moving out. And that allows for immediate depolarization of the postganglionic neuron. Okay, and we kind of describe the bigger picture here, right? That this makes sense. The fact that when we're at a ganglia, there is no specific or a unique response because we're not necessarily at a local tissue. So that there isn't a individualized response the way that we see with metabotropic receptors. At the ganglia, the receptors are fast because we're just trying to communicate that signal from the preganglionic neuron to the postganglionic neuron. And so it's a fast, immediate depolarization of that subsequent neuron. So it's going to be a fast nicotinic receptor. at the neuroeffector junction. So bear in mind that the junction here differs from the junction here. This is a neuron to neuron synapse. This is a shorter distance, as well as there is only neurotransmitters being released here, and they're being released across that synaptic junction. At the neuroeffector junction, it's a greater distance. That was one major difference. The other difference is that we have these swellings that are called varicosities. So varicosities are these bulges in the axon terminals that actually have the vesicles with the hormones, or not hormones, but neurotransmitters stored that are going to be released at this neuroeffector junction. So there were a few differences we described between the neuron to neuron synapse and then the neuroeffector junction between the post-ganglionic neuron and the effector tissue. So here we're going to have metabotropic receptors. Specifically in the sympathetic side, it's going to be an adrenergic receptor. So this is where we had different options, alpha-1, alpha-2, beta-1, beta-2, beta-3, that would bind norepinephrine, epinephrine, or even dopamine. And remember, we said that these receptors had differing affinities, right? We'll talk about those differing affinities coming up, but some would prefer norepinephrine, some would prefer epinephrine, or some would have no preference. They would have equal, affiliation for both. So these are things to bear in mind when you think about the neuroeffector junction as well. Let's go on to the parasympathetic system. So this is going to arise still from the lateral horn. Now it's coming from different segments of the spinal cord or brainstem. So here we're thinking about the nuclei that give rise to cranial nerve 3, 7, 9, and 10, right? Which are going to be in the brainstem. As well as S2, S3, S4, which are going to be the sacral segment of the spinal cord. So these are the areas that give rise to the pre-ganglionic neurons in the parasympathetic system. Also, we want to think about the overall function of the parasympathetic system: rest, digest, increasing of gastric motility, as well as glandular secretions. And that will all be aligning with that slowed, stimulatory response, or more of that resting phase. The pre-ganglionic neuron here is longer. The post-ganglionic neuron is shorter. There are no alternate options. So there's only one route for the parasympathetic communication. It's a longer pre-ganglionic neuron to a ganglia that is far out and very close to the effector tissue in question. And then a shorter pre-ganglionic neuron synapsing onto that tissue. Notice that the receptors and neurotransmitters at the ganglia are the same. So acetylcholine being released and then binding to a nicotinic cholinergic fast receptor. Whereas at the neuroeffector junction, the receptor is different. So here it's no longer an adrenergic receptor because the postganglionic neurons here generally are going to release acetylcholine, and then that is going to bind to a muscarinic receptor. So muscarinic receptors are cholinergic because they can bind acetylcholine, but they're metabotropic in that they are slow, they have that signal cascade, second messenger involved, and so that's going to be a slow, specific, tailored response depending on exactly what tissue we're looking at. The one exception I want to point out is that in the sympathetic nervous system, sweat glands also release acetylcholine, which bind to muscarinic receptors. So there's a small exception with sweat glands where in the sympathetic side, acetylcholine is the neurotransmitter released. Let's move on to the somatic nervous system. And this is where we have voluntary movement of skeletal muscle, and that is going to be involving a motor neuron. So here we don't have two different neurons, it's just one extended neuron going from the ventral horn. So here we're no longer moving or arising from the lateral horn of the spinal cord. Here, the fibers arise from the ventral or the so-called motor horn of the spinal cord. They still exit through the ventral root. So don't confuse the ventral horn with the ventral root. The ventral root is the exit point of the spinal cord, and all the fibers will leave through the ventral root, but they're going to arise from different parts of the horn of the spinal cord. So arising from the ventral horn and then leaving via the ventral root, and then forming this motor neuron, which goes all the way out to skeletal muscle. This is only involving one neurotransmitter, acetylcholine always, and only one receptor, nicotinic always, right? So again, it's going to be a fast response here on muscle. And thinking to the big picture, when we move our skeletal muscle, that is immediate. So it's not tailored or, unique to any different types of tissues. It is going to be an immediate depolarization, which we refer to as an end plate potential that happens on skeletal muscle. The other thing I want to point out here is the concept of the motor unit. So a motor unit is one motor neuron and all of the fibers it innervates. Remember, one motor neuron can innervate many muscle fibers within a specific muscle group. So that unit is referred to as a motor unit. Okay. Let's talk about the receptors here and their varying affinities. So the adrenergic receptors specifically. So here are the different types of receptors that we had. Here is their specific location. So alpha-1 and alpha-2 are typically found on vascular smooth muscle. So they're usually in our blood vessels. They both have an affinity for norepinephrine over epinephrine. Their second messenger and their signaling cascade is going to be different. So for alpha-1, this is the only one that resulted in release of IP3 and DAG. Remember, phospholipase C was involved here, and then this resulted in generation of IP3, DAG. This was involving a G-stimulatory protein, and then the effect on the tissue was excitatory. So it's going to kind of increase the smooth muscle or vascular tone. Alpha-2, on the other hand, is resulting in a different second messenger, and it's going to have a different response on that second messenger. So because it is coupled to a G inhibitory protein, it's going to decrease cyclic AMP release. So the second messenger is different, but also the result on that second messenger is different here. That, however, is still going to result in an excitatory response on the tissue. So inhibitory to its second messenger, but the result of that is exciting the tissues that are involved. Beta-1, beta-2, and beta-3 all share the same second messenger, and they all have the same response on that second messenger. It's cyclic AMP by way of adenylyl cyclase, resulting in increase or stimulation of that cyclic AMP. However, the affinity differs. So for beta-1, there's an equal affinity for norepinephrine and epinephrine. That is also true for beta-3. Beta-1 and beta-3 have zero affinity or zero preference as far as their neurotransmitter. Beta-1 and beta-3 are also both excitatory to the tissues. Okay, beta-1 is found in the heart and kidneys. Beta-3 is found in your adipose tissue. All right, so they behave quite similarly, but they're found on different tissues. Beta-2, on the other end, prefers epinephrine. So it's the only one that prefers epinephrine. And that preference results in an inhibitory response to the tissues. So even though it is increasing its second messenger on that specific tissue in the respiratory tract, in the uterus, also the lungs is left out here, that will result in inhibition to that specific tissue. Okay. And then lastly here, just to compare the difference between the neuroaffector junction and the neuromuscular junction. So here at the neuromuscular junction, we have the highly folded motor end plate. We also only have nicotinic cholinergic receptors, which result in that fast, immediate depolarization by way of sodium moving inward more so than potassium. We also have a terminal bouton is the unique structure, at the motor neuron ending. And then as far as the neuroeffector junction, this is where we have the varicosities. This is going to be the postganglionic neuron synapsing onto the neuroeffector tissue in question. And depending on if this was a parasympathetic or a sympathetic side, the neurotransmitter would be different. So in the parasympathetic side, this postganglionic neuron releases acetylcholine. In the sympathetic side, this postganglionic neuron releases norepinephrine. And then the general synaptic principles will apply. So we talked about this in the previous unit, but still remember those general synaptic principles. The action potential arrives at the end of the neuron, stimulates calcium moving into the neuron ending, whether that be the terminal bouton or the varicosity or the axon terminal, if it's just a regular neuron. It's going to have calcium rush-in, and then that's going to result in exocytosis. And then whatever neurotransmitter is released will cross the cleft or the junction and then have its result by binding to the subsequent receptors.